Hello, everyone. My name is Jonathan Merrill, the Indian Health Service Deputy Director for Healthcare Quality, and welcome to the Indian Health Service training video on the strategic plan and quality priorities. This video is meant to help you understand how the IHS Office of Quality, or the OQ, supports the IHS mission of raising the physical, mental, social, and spiritual health of the American Indian and Alaskan Native people to the highest level. The strategic plan is a large part of this effort, so understanding its goals and objectives, as well as how they are implemented to improve the management, operations, compliance, and overall delivery of care within the IHS system is crucial. Before we begin with the strategic plan, though, a little background on the OQ would be helpful to see where the office fits into the overall IHS system. The OQ is a result of consultation with tribal nations on how IHS can address challenges in healthcare delivery. The office is organized into three divisions: the Division of Quality Assurance, Patient Safety and Clinical Risk Management, and Innovation and Improvement. Each division focuses on an area identified as needing specific attention and monitoring to improve the overall healthcare delivery. We also have the Quality Portal, which provides access to our resources for facility-level implementation. The IHS Strategic Plan goals and objectives are created in partnership with our tribal and urban Indian partners. We start by conducting an environmental scan of key inputs and a strengths, weakness, and opportunity and threats or SWOT analysis, which looks at what the plan should address. From there, the initial framework is shared with our tribal, UIO, and other partners throughout tribal consultation and urban confer, through listening sessions and meetings. There is an IHS Tribal Strategic Planning Work Group, which reviews all of the feedback from tribes, tribal organizations, UIOs, and IHS staff to determine how to integrate that feedback. The current 5-year strategic plan began in 2019 and will end in 2023. IHS is committed to continuous improvement, so while the current plan will end in 2023, it doesn't mean improvements will end. Simply that the priorities and goals will be reevaluated and a new 5-year plan will be created. Now, before we dive into the strategic plan, understanding the overall IHS approach will be helpful. Quality is not a buzzword to IHS, and while we will break out the strategic plans into priorities, goals, and specific targets, we want to address the importance of viewing these parts that make up the improved quality goal for IHS. IHS works to take a holistic view of these components. As such, IHS works with many partners because we cannot do this alone. The OQ is only a small portion of the effort to improve quality, but the quality goal is applicable to all offices and service units within the IHS and is a guide to their efforts. We also recognize that the strong, resilient, and supportive culture of each tribal nation is unique and must be included in any improvement. It is one of the reasons we ensure to approach tribes as partners within the program. The current strategic plan is based on 4 longstanding IHS priorities: people, partnerships, resources, and quality. Ensuring we have the best people to provide the services is the top priority. We recognize that while we can be an outstanding organization, the interactions with people delivering care are critical to building trust, improving relationships, and improving experience. Partnerships is the second priority, which demonstrates the dedication to ensuring we are connected to the best resources available. Confirming our resources are allocated and used to reach the most effective outcome is the third priority, with an emphasis on our goal of quality in all of our work being the fourth. While these are listed in an order, we approach them as being equally important to working toward beneficiaries receiving high-quality care. With the IHS vision and mission in mind, followed by the 4 priorities, the current strategic plan is focused on 3 strategic goals: access, quality, and management and operations. The first goal focuses on ensuring everyone is able to easily receive outstanding and comprehensive and culturally appropriate care. The second focuses on promoting innovation to ensure care is comparable, if not better, than from outside entities. The third goal recognizes resource management, and allocation must be done effectively at operations levels. All three goals work toward eliminating the health disparities American Indian and Alaskan Native people are still experiencing. We'll now dive deeper into each individual goal and the objectives within them. Objectives help provide specifics to make broad goals like access more actionable. The objective with the goals of the strategic plan help focus on the specific areas for improvement. The goals are the priorities revealed in the tribal consultation and urban confers. Goal 1, to ensure comprehensive, culturally appropriate personal and public health services are available and accessible to American Indian and Alaskan Native people. This goal has 3 objectives identified to achieve this. Objective number 1 is to recruit, develop, and retain a dedicated, competent, and caring workforce. IHS is committed to improvement by taking specific steps, such as improving the internal recruitment and human resource capability of IHS, but also through improved partnerships and incentives for employees. We are working with the National Health Services Corps, scholarship and loan repayment programs. This will hopefully entice professionals, but also increase the American Indian and Alaskan Native enrollment into educational programming to become medical professionals. Beyond recruitment, we understand the need for supportive work environment, so we are expanding the search for additional paraprofessionals to support staff, as well as increasing the capacities of existing staff. This includes more leadership and mentoring opportunities, training to address communication and equity, and continued education on areas most identified as needed by staff and our beneficiaries. The second objective is to build, strengthen, and sustain collaborative relationships. We don't need to tell you how important interpersonal relationships are, but for this objective, IHS is focusing on creating collaborative programs with tribes, urban Indian organizations, to develop community-based health programs, as well as expanding outside partnerships with federal, state, and other organizations. We know we can't do it alone, and we can't think of a better way to serve our communities than to partner with the people in it. These programs will help expand professional options, as well as ensure the programs meet the unique needs of the community. The third objective is to increase access to quality care services. Although there are many ways to do this for this strategic plan, increasing access includes providing a better system of preventative care, increasing alternatives to service access, such as using telemedicine, improving efficiency within the clinical settings to increase capacity, and ensuring resources are allocated appropriately to the needs of the clinics. This objective not only looks at expansion of services, but improving the current service options. We know the need to continually improve our current system in addition to looking to the outside for ways to improve. Investing in our employees, systems, and facilities is just as valuable as looking for new ways to meet the needs of our beneficiaries. The second goal of the strategic plan is to promote excellence and quality through innovation of the Indian health system into an optimally performing organization. This goal has 2 objectives to focus the efforts on innovation and improvements. The first objective is to create quality improvement capability at all levels of the organization. This objective recognizes true improvement, and not only in the clinic, but goes all the way up into the service unit, the area, the headquarters offices. It also goes to the individual within these offices and providing services of any kind in the community. Because improving capability is a complex concept, this objective is further broken down into 8 strategies. 3 strategies are focused on quality data, which focuses on improving not only the transparency of data collected, but the quality of the data source. The improvement for this plan hones in specifically on maintaining organization-wide standards when it comes to data metrics. Also governance, management, and operations. We want the data to be relevant to the issues, not simply numbers that look good. Good data can help us improve in meaningful ways, and we are happy to report that 100% of our hospitals and ambulatory facilities have active quality improvement programs with documented procedures to meet this goal. The second strategy is quality improvement, which looks to improving the training, the mentoring, coaching, and accountability of staff. Improving healthcare means we have effective staff throughout the organization. The third strategy is standards of care. IHS is working to implement the model for improvement in all areas, but also to ensure that patient care is patient-centered. The beneficiaries of IHS healthcare need to know that they are the heart of the work that we do. As of today, 63% of IHS hospitals and 100% of ambulatory facilities are recognized patient-centered medical homes. Quality data, quality improvement, and standards of care are the scaffolding IHS will use to improve capabilities at all levels of the organization. The second objective of Goal 2 is to provide care to better meet the needs of the communities. While there are many approaches, we are focusing on culturally appropriate and responsive healthcare. Each tribe has its own unique culture and tradition, and we recognize that whole person healthcare must reflect these traditions. We also understand healthcare can raise complicated emotions. So we are working to implement trauma-informed care models to ensure beneficiaries receive harm-free healthcare services. We cannot fix the past, but we can work to protect the future. The third and final goal of the current strategic plan is to strengthen IHS program management and operations. The goal has 3 objectives: to improve communication, information technology, organizational management, and increased accountability. The first objective, to improve communication within the organization, includes communication with tribes, urban organizations, and other stakeholders and the general public. Communication is easy, but effective communication is hard. We recognize there are always ways to improve our communication and ensure we are achieving transparency, collaboration, and mutual understanding. This strategic plan objective places the impetus on the IHS to provide proactive communication efforts and increase active partnerships. We know many organizations are working to provide services to our communities, so we are working to streamline the efforts to provide a wider range of services to meet these needs of the communities. The second objective is to secure and effectively manage assets and resources. This particular objective goes beyond simply improving the business process to include improving infrastructure, capacity, sustainability, and the educational resources we offer to beneficiaries. Within this, IHS is looking to improve and expand the technical assistance to service unit and area offices, develop standardization for funding management and opportunities, to increase oversight in needed areas. We understand that improving the structure of the services is the best way of improving the outcomes of these services. The third objective is to modernize information technology and information systems to support data-driven decisions. RPMS has been the software for IHS for many years, and while it has performed adequately, it's time to modernize. The current Health Information Technology, or HIT, modernization project is underway and is partnering with tribes and urban Indian organizations to find a solution that meets most of the needs. Whatever the solution is, the centralization of data and records will increase our ability to better serve our beneficiaries. Beyond HIT, IHS is working on improving overall availability and capacity of the IT staff within the IHS. We are working towards an IT infrastructure system that fosters transparency, integration, and access to clinical, administrative, and financial data in order to support our culturally appropriate care, our decision-making, and advocacy. The Office of the Inspector General previously noted effective quality improvements rely on accurate statistics, which come from IT and electronic health record systems. Improving the staff understanding of this will ensure the data is reflective of the reality and accuracy. The current strategic plan may only have 3 goals, but the work to achieve them are significant. This plan, however, provides a clear representative roadmap of how we can continue to improve the health equity of American Indians and Alaskan Native people. With the priority foundations of people, partnerships, resources, and quality, the strategic plan infuses quality into everything we do, making improvement a responsibility for everyone on the IHS team. I truly appreciate your time today and know that this is a lot of information. You can read the strategic plan as well as explore the goals more by visiting ihs.gov/strategic plan. Thank you for your time and your service. We look forward to continuing our work to achieve the mission of raising the physical, mental, social, and spiritual health needs of American Indian and Alaskan Native people to the highest level.